Hello, my name is Isabella Goldberg, and I am a sophomore at the School of Nursing at the University of Pittsburgh. I would like to thank the National Conference on Undergraduate Research for allowing me to share some of our work with you. I'm going to be presenting a secondary analysis of data from a randomized control trial. It is known that family caregivers play an important role in patients with a primary malignant brain tumor. Caregivers, specifically in the neuro-oncology world, have negative effects on their emotional and physical health because of the stress that they are under. What we don't know is how this translates to healthcare utilization. The purpose of this analysis in caregivers of persons with a primary malignant brain tumor was to examine associations between caregivers' sociodemographic variables as well as their emotional health with markers of caregivers' healthcare utilization over the year following the patient's diagnosis. There were 112 caregiver patient dyads included in our pre-intervention data that fell into two different groups meeting certain criteria. The caregivers had to be non-professional, over 21 years old, able to use a telephone, able to read and speak English, and had to be nominated by the patient as their main supporter. The patients had to be diagnosed with a primary malignant brain tumor within 3 months of consent and had to be over 21 years old. Our measures of healthcare utilization were self-reported of their caregiver's number of visits to their primary care provider, whether their visits were preventative or illness related, the number of prescription medications taken on a regular basis, their number of comorbid conditions, and whether their comorbid conditions stayed the same or improved versus got worse over time. The following caregiver variables were tested for associations with measures of healthcare utilization: gender, age, insurance status, yes or no, relationship with the patient, spouse and other, depressive symptoms, number of hours providing care per day, mastery, and burden. Our findings suggest that both clinical characteristics and multiple measures of caregiver distress affect the proxies for healthcare utilization in this analysis. It was found that caregivers with lower burden related to their self-esteem reported more visits to their primary care physician. There were trends P less than or equal to 0.010 for caregivers to have an illness-related visit rather than a preventative care visit, if they reported higher levels of depressive symptoms and higher burden related to feelings of abandonment. No sociodemographic variables or emotional health measures were associated with caregivers' number of prescription medications taken on a regular basis. There were trends P less than or equal to 0.10 for caregivers with higher reported burden related to abandonment and disruptions in schedules to report more comorbid conditions. Lastly, caregivers who had the following characteristics were more likely to have worsening comorbid conditions: higher level of depressive symptoms, increased caregiver burden related to feelings of abandonment, interruptions in their schedule, and lower levels of caregiver mastery. Data support primary care providers' role in identifying caregivers that are at risk for deteriorating health and intervening to help them to take important self-care measures. Thank you all so much for listening to my presentation.